although the term eco-anxiety has been gaining ground. This is just one of the terms that are used to refer to our psychological response to climate change, such as solastalgia, environmental distress, etc. Eco-anxiety is not currently listed in the Diagnostic and Statistical Manual of Mental Disorders, meaning that doctors do not officially consider it a diagnosable condition.
Our first action is to introduce eco-anxiety into international curricula. The United Nations Educational, Scientific, and Cultural Organization has a plan for education for sustainable development that addresses psychological health and well-being as a goal, but it lacks education about eco-anxiety. We recommend that local and global guidelines for eco-anxiety curricula be created and for it to be appropriate for several subject areas to better represent the vast impact of climate crises on mental health. We recommend that education be catered to a range of ages and that curricula encourage discussions where learners can create helpful actions and skills to provide them with a sense of control and self-efficacy.
Climate change can have a significant impact on mental health. Research has shown that rising temperatures, extreme weather events can lead to immediate and longer-term mental health challenges. These can include anxiety, depression, PTSD, and gender-based violence. Even people who have not been directly affected by climate disaster can experience eco-anxiety. However, to combat eco-anxiety, it is important to educate the public about this issue. Piccola 2020 recommends that educators practice self-reflection about their emotions and attitudes, and to also make an effort to provide various positive role models of coping with eco-anxiety. Furthermore, Clayton 2020 suggests taking action by joining a local climate action group or emailing politicians and large corporations to put pressure on them to act. It is also important to take a mental health break for yourself when required, as to not be constantly thinking about climate change and inducing further stress in self.
The context for our next recommended action is to consider the direct impact of climate change on mental health. We see this in the strong association between rising temperatures and increased rates of suicide, in injuries from climate-driven disasters, and high rates of associated psychological trauma. Eco-anxiety can be broadly conceptualized as an indirect impact of climate change on mental health, emotional distress on a global scale. As Dr. Howard, Northern Canadian physician and WHO Climate Change and Health Chair proposes, the first step is for medical professionals to understand the threat of climate change and thus take climate anxiety seriously. But beyond individual practitioners, there is need for greater awareness at higher organizational levels. Implementation of this action could look like lobbying to mental health associations to unite experts, leaders, and advocates to ultimately achieve the goal of providing services that directly target eco-anxiety.
Action 3 is to promote research in eco-anxiety, specifically for the purpose of promoting evidence-based strategies to cope with this unique form of anxiety. Educators, researchers, and organizations need more information about eco-anxiety. There's a lack of practical resources in relation with it and its coping mechanisms. It can be fought by using methods that help people to identify ecological emotion, build constructive climate change narratives, and even share information about how to cope. Overexposure to climate disaster content is common, and it can lead to eco-paralysis, but media coverage of the best practices in pro-environmental behavior can help mitigate this. Advocacy messages through social media with solutions, call to action, and even seeking social connections are coping mechanisms. But future research should also evaluate the effectiveness of strategic message framing and elaborate media that identifies and uses coping mechanisms. It should also use qualitative and quantitative methods, as well as focus on life experiences, conduct longitudinal research about results, and also study ecological emotions in different groups in a representative manner.
Most of the current evidence comes from Western countries, necessitating future research from non-Western countries where Indigenous and young people are the most impacted groups. Social media is accessible and powerful for awareness raising on climate change, enabling engagement with many audiences, sharing knowledge while uniting to separate communities. Problem and meaning-focused coping mechanisms are associated with young people's ability to cope with climate change, leading to more positive feelings in this group.
Eco-anxiety is a neologism that emerged in the 2000s and will be voiced more and more frequently in the future. It's crucial to address this collective concern that every mental health issue society-wide. Through climate education, incorporating local to global perspective and fostering discussion, we empower individuals to regain control. UNESCO is working on sustainable ability education, but there's a need to emphasize eco-anxiety. Let's use social media to raise awareness and share personal story, and rally for policy change. We must lobby mental health in institutions and policymakers to recognize it and tackle equal anxiety head-on for resilient communities. Thank you.